I'm Dr. Seth Wolstenhume. I'm a board-certified functional neurologist through the American Chiropractic Neurology Board, and I run Activate Brain Clinic and Chiropractic here in Ogden, Utah. I've been board-certified for 7 years. We've been running Activate Brain Clinic for 5 years. So I went to chiropractic school at Life University in Marietta, Georgia for 4 years, and then I did my continuing education through the Carrick Institute for Neurology. So there's only 4 of us here in the state of Utah that are board-certified functional neurologists. The patients that see us are concussion patients, anxiety, depression patients, behavioral disorders. We see a lot of auto accident cases with traumatic brain injuries. We see a lot of chronic headaches, chronic migraines, brain fog, cognition types of issues, strokes. Basically anything brain related we can work with, finding different deficiencies in the brain. So the NSI is a touchscreen TV that we use for hand-eye coordination, for speed and reaction time, for timing mechanisms. We use it a lot with our behavioral disorder children and our concussion patients. The NeuroSage is a lot of sensory stimulation with different pictures on the screen, different sound frequencies, different lights and colors. We're standing on a vibration plate as well, so we're trying to really stimulate different areas of the brain through a big, wide variety of sensory stimulation. The Live O2 exercise bike is exercise with oxygen that we can turn on and to low, so it stimulates and simulates high altitude training, so we can get a lot of increased blood flow throughout the system, especially up into the brain, and along with that blood flow, increase oxygen that can help heal and repair tissue in the brain. We do chiropractic adjustments, again, trying to help with mobility and range of motion in the spine. Also helps relieve stress on the nerves, helps increase that connectivity between the brain and the body. We do a nasal adjustment, nasal specific technique, where we use a balloon and inflate it inside the nasal cavity to help move and mobilize the joints of the skull, mainly the sphenoid and occiput. That joint is the main joint inside the skull, and it allows for increased cerebrospinal fluid, blood flow, mobility and function in the skull to help decrease headaches, brain fog, concussion, and other things of that nature. So the neuro rehab that we do is a wide variety, again, of sensory. So we do a lot of hand-eye coordination. We use infrared and red light lasers. We use electricity. We'll use vibration. We'll use core exercises. We'll check primitive reflexes, all to evaluate and treat varying challenges in the nervous system and in the brain stem to help improve concussions and other behavioral disorders. The Live O2 exercise bike is honestly one of the best things we have here at the clinic. It is used in so many different ways. We use it a lot with our concussion patients, but also with our athletes. Honestly, anybody should really be able to use it and should use it because it helps increase blood flow for the brain to help heal it, help repair it, help increase cardiovascular abilities. Honestly, it is the best thing that I use in the office. I use it twice a week myself to try to keep my brain healthy, to keep my lungs healthy, especially here in Utah with inversions and fires and poor air quality. It's great for viruses, colds, all those types of things. The bike is by far one of my favorite things here at the office. At the office, we have a wide variety of patients, from newborns. My youngest patient besides my own babies have been 4 days, and my oldest patient was 102. So anywhere in between, honestly, we see improvements, we see changes. We do a lot of our care plans with younger children with behavioral disorders, anxiety, ADHD, but then we get our older patients who have had head traumas or strokes, as well as other cognitive issues. But anywhere in between, we can find something to benefit you here at the clinic.